Many of you have been asking me, how do I decide between types of anesthesia for my patients? So in general, I have a little algorithm that I like to follow. If I have a patient that's deathly afraid of anesthesia, and we don't do general, which I feel causes a lot more post-operative complications and a little bit more dangerous for the patients if they don't have to be done that way, I do the IV sedation, which is like a twilight. So those of you that have had a colonoscopy before, you get this medication called propofol that you go to sleep with. I put the local anesthesia in, patient goes to sleep and they wake up and the surgery's done. The other way I do it is under local anesthesia with oral sedation. So I give you oral meds to relax you. I describe to my patients, it's like you've had a couple martinis, so you're relaxed. I put the numbing shots in, so like when you go to the dentist, once the anesthesia is in, you don't feel pain, you just feel tugging and pulling. So in general, if the surgery is less than 3 hours, I'm okay to do the oral sedation as long as the patient's comfortable and the patient's not very anxious. If the patient has a lot of anxiety about hearing what's going on or being able to speak or just being anxious about being awake during surgery, then we will go towards the IV sedation. Any surgery over 4 hours, so if I'm doing a full face rejuvenation with a blepharoplasty, brow lift, deep plane facelift, neck lift, laser, and fat transfer, those take me around 5 hours. I also generally suggest my patients to do the IV sedation. However, I have many motivated patients that want to avoid the anesthesia, and we're able to do it under local anesthesia. So this is a discussion I can have with you, but in general, if you're super anxious, do the IV sedation. If it's a surgery more than 4 hours, consider the IV sedation.